Periods are irregular. Weight is increasing. Acne is appearing on the face. And then the doctor says, PCOD. But what exactly is PCOD? Is it a lifelong disease? Is marriage or pregnancy possible? And most importantly, can PCOD be completely controlled? If you stay till the end of this video, all the confusion around PCOD will become clear. In India, about 1 to 2 out of every 10 women have PCOD. But the real problem is this. Many women don't even know they have it. And many others take unnecessary stress after hearing the diagnosis. So let us understand PCOD step by step, in a simple and clear way. PCOD versus PCOS. What is the difference? First, let us clear the biggest confusion. The correct medical term is PCOS, polycystic ovary syndrome. In India, we commonly call it PCOD. In simple words, PCOS is a hormonal and metabolic condition. It is not just a problem of the ovaries. In PCOS, multiple systems are involved. Hormones, insulin, menstrual cycle. That is why PCOD is not an infection, not cancer, and not something to panic about. Why does PCOD happen? PCOD does not have a single cause. It happens because of a chain reaction inside the body. First, insulin resistance. When the body does not use insulin properly, the pancreas produces more insulin. High insulin levels send a signal to the ovaries to produce more male hormones, androgens. Second, hormonal imbalance. Because of excess androgens, eggs do not mature properly. Ovulation may not happen regularly. Periods become irregular or delayed. Third, genetics and lifestyle. If there is a family history of PCOD, along with a sedentary lifestyle, stress, and junk food, the risk of PCOD increases. Important point. PCOD does not occur only in overweight women. Lean PCOD also exists. Symptoms of PCOD. Not every woman has the same symptoms. Common symptoms include periods coming after 35 to 60 days, skipped periods, unwanted facial or body hair, acne and oily skin, weight gain, especially around the abdomen, hair fall or thinning, delay in getting pregnant. Some women also experience anxiety, low mood, body image issues, and these symptoms are real and valid. How is PCOD diagnosed? Diagnosing PCOD based only on ultrasound is incorrect. Doctors usually follow the Rotterdam criteria. For diagnosis, any 2 out of these 3 are required. Irregular or absent ovulation, signs of excess androgens, clinical or blood tests, polycystic ovaries on ultrasound. Doctors may also advise additional tests. Thyroid function, prolactin levels, sugar test, OGTT, lipid profile. In teenagers, diagnosis done very carefully to avoid overlabeling. Treatment of PCOD. This is the most important part. PCOD does not have a permanent cure, but it can be very well controlled. 1. Lifestyle, the foundation. Lifestyle management is compulsory for everyone. 30 to 45 minutes of daily exercise or walking. Even 5 to 7% weight loss can improve periods. Reduce junk food, sugary drinks, and refined carbohydrates. Maintain proper sleep. Manage stress. 2. Medicines, based on symptoms. Treatment is individualized. If pregnancy is not planned, oral contraceptive pills may be used. They help regulate periods. Improve acne and excess hair growth. If insulin resistance or sugar issues are present, metformin may be advised. It improves insulin action. It is safe for long-term use when prescribed correctly. If pregnancy is planned, letrozole is the first-line medicine for ovulation. It closely mimics the natural cycle. Not every patient needs every medicine. PCOD and pregnancy. The most common fear is pregnancy possible in PCOD? The answer is yes, absolutely. Most women with PCOD conceive naturally. or with simple medical treatment. They go on to have healthy pregnancies. The key points are: do not delay seeking help. Avoid self-medication. Take proper medical guidance. Long-term risks and monitoring. If PCOD is ignored, it can increase the risk of type 2 diabetes, high blood pressure, cholesterol problems, endometrial issues. That is why regular follow-up is important. PCOD is not a curse, not a guarantee of infertility, not a life sentence. With the right lifestyle, the right medicines, and the right mindset, you control PCOD. PCOD does not control you. If you found this video helpful, like, share, subscribe for more science-based health content.